I love my IPL devices, especially in the treatment of melasma, because of the pathophysiology of melasma. This is a very famous article talking about the altered genes found in melasma lesions. And see, there are altogether 279 genes are altered, expressed differently in melasma lesions compared to the normal counterpart. And all the 279 genes are in three types. And the first type is the Wnt pathway, and that's quite related to inflammation. This means that melasma is an inflammation, so we need to treat the inflammation and to control the vasculature, the new, how to say that? Sorry about my English. For 2 years, I almost do not speak English. I read English, I read very well, but oral presentation is so difficult for me. So,
okay, so my talk will be on the using IPL for acne. And this is all my disclosures. I will talk about some IPL that I use for my clinical studies, and I'll talk about some product in these two. Okay, as what we know, acne is actually conventionally treated with topical and oral medicine. But when you put people with acne or severe acne into a long topicals and oral medication, you get problem with side effects, and you need to treat them for a longer period of time, and it's come with poor patient compliance. So sometimes we use laser and light-based devices to use as the alternative modalities. But the mechanism of action is something that you need to focus, because if you don't know, you just like fire the lasers, fire IPLs on without knowing how it can improve the acne.
And so about IPL, but 20 years ago, I bought my first IPL and have used for pigmentation removal. Now I have 3 IPL devices. The one is Icons, and other 2 devices not latest models. What is IPL? IPL is intense pulse light. Xenon lamp had broad band lights, approximated solar light spectrum. It's like a flashlight of cameras. The flashlight, it had only the 5 to 10 millisecond pulse duration. It's almost same as IPL, but it's not intense, only pulse light. And IPL have cut-off filter, as you know.
The dream IPL, and then we'll let you discuss from that. See?
Yeah, good. Thank you.
So for me, this is we were talking about my dream IPLs now, right?
Yes.
My disclosure is I don't like IPL. I do not like it at all. So, if you know me, IPL, I'm not using it for anything much rather than photo rejuvenation. Why? I think we mentioned that, when comparing with light and laser is more effective. Even Dr. Miyata is still talking about picosecond lasers, right? So he loved it. Why? I think for me, IPL function-wise is more like a duck. So, it can do a lot of things. It can treat many, many things. So, like a duck can swim, but it's not as good as fish. And then duck can also fly, like flutter, but it's not as good as a bird. So anyway, IPL for me is not as good as laser. So if I have both IPL and laser in my clinic, and then when the patient with any indication coming in, I will always go with
the IPL machine. Actually, they have the already combined, for example, radio frequency altogether and make the treatment effect differently. My first IPL actually is that kind of combination. So it's been there. I've been using that for more than 10 or 15 years. And I found that kind of combination, 15 years ago, especially very in treating rosacea. Of the IPL with radio frequency can treat rosacea even better